So let's get into it. Many of us associate depression as something that is fleeting or something that you can just snap out of, when really it's far more complex than that. What's up, everyone? Welcome back to my channel. My name is Jessica Gaddy, licensed clinical social worker and psychotherapist, excited to bring you mental health education and tools to help you along your wellness journey. So after a 2-year pandemic and navigating the woes of life, we're going to talk about something that might hit home to a lot of us, and that's depression. So depression is more than just feeling sad or not being able to get out of bed in the morning. It's a really complex and often misdiagnosed condition that affects nearly 5% of our global population and 30% of Americans in the US alone. So as a mental health practitioner, we look at different signs and symptoms to be able to diagnose a depressive episode. Those key things are major changes in your mood, such as feeling more tearful, sad, empty, irritable than usual. We also look at if there's been a loss of interest in your normal activities. Maybe you're not hanging out with friends as often, or you're not going to the gym as much, or doing things that you normally enjoy. We also look at changes in your sleep and eating patterns. Are you sleeping more than usual, not getting enough rest, not being able to sleep throughout the night? Or are you eating more than usual or not eating enough? These also have an effect on our psychomotor agitation. Are we more restless than usual? Maybe you're fidgeting or shaking your leg or pacing around. You experience an increased fatigue or loss of energy. Has that affected your way to make decisions and focus? So last but not least, and probably the most important, is we look at if you've had any recurrent thoughts of death, suicide with or without a plan, or even engaging in self-harming behaviors. As mental health practitioners, looking at these different signs and symptoms, we often look at the frequency and the duration of them, meaning how long have they persisted and how often are they happening. And also, we want to make sure that these symptoms aren't influenced or affected by some type of other medical condition or substance use. With this in mind, it's important that you're regularly checking in with your physical health provider and your mental health providers, because there's often some signs or symptoms that can look different in different people. Like, did you know that Black women are more likely to endorse somatic symptoms like insomnia, fatigue, or even a loss of libido? They may also endorse anhedonia, which is a loss of pleasure, unlike a lot of the textbook symptoms that we talked about earlier. If you notice yourself having any signs or symptoms of depression, then it's important to implement some coping strategies and different tools to help you manage before, between, and beyond therapy. For me, one of my favorite coping tools is journaling. I love to journal out my thoughts and challenge my negative distortion. Being able to reflect in my journal helps me recognize what I'm struggling with, what are my triggers, and how can I process through them a little bit better. But it also helps me kind of track how I'm feeling and how often I'm feeling these symptoms, so that I know when it's time to get some additional recruitment. Whether that's therapy, whether that's talking to my friends, or whether that's engaging in more self-care activities. So if this resonated with you, feel free to like, follow, and subscribe, and hit that notification bell so that you can stay connected.